Hello and welcome to our webinar on research needs to protect health and the environment. This event is co-organized by the EU agencies for environment, food safety, and chemicals. I'm Adam Melwan, your host. So today, we're joined by experts from ECHA, EEA, and EFSA. They're here to share key updates on their research needs, offering a look into the intricacies of the regulatory framework that governs our scientific work. We'll be taking a closer look at emerging research needs to address regulatory challenges. We also hope to be able to inspire future research projects, such as those under the Partnership for the Assessment of Risks from Chemicals, also known as PARC. Our hope is that these projects would result in tangible future outcomes for regulators. Now, this webinar is particularly useful for researchers who specialize in public health, environmental sciences, chemical safety, and food safety and nutrition. It's really an opportunity to align with the latest developments in EU regulatory science and to find collaborative pathways for research. The insights shared today will not only highlight the current research priorities and challenges identified by the EU agencies, but will also underscore the significant impact your research can have in the realm of regulatory science. And last but not least, you have the opportunity to ask questions from the experts that are here today. You can send them in throughout the event by going to slido.com and using the event code SCIENCE2024, or use the QR code on this slide to connect instantly. We'll answer them during the live Q&A. Now you can also upvote questions to show us which ones are most relevant to you. If you want to address a specific speaker, include their name in your question. Now, we can only cover topics within the webinar scope. Any other questions can be sent to any of the three agencies with us today. Their contact details are on this slide. A Q&A with all answers will be published after the event. If your question is not answered during the session, you will find it in the published Q&A. The presentations are already on our website, and the video recording will be available right after the event, with the Q&A coming soon. Now, we have a packed program lined up for you today. It features experts from the three EU agencies who will share their knowledge on protecting human health and the environment. After I've set the stage, Safia Korati from ECHA, who is also coordinating PARC, will introduce you to the overall framework of today's webinar. Following Safia, Jean-Loup Dorn from EFSA will present on new approach methodologies to advance EFSA's risk assessment, highlighting innovative strategies and tools. Then, Nadia Serioli from EEA will share their research priorities for chemicals, focusing on current trends and future direction. After Nadia, Jane Cayley from ECHA will cover bioaccumulation. She'll be focusing on specific substances, air-breathing animals, and new approach methodologies that are critical for our assessments. Finally, I'll give some take-home messages before we start our live Q&A. So thank you for joining us, and we hope you find the webinar informative and engaging. Safia, over to you.
Hello everyone, my name is Safia Korati, and I am a scientific officer working at ECHA in the Hazard Assessment Directorate. In this short presentation, I will present you the context on which we have articulated those research needs. I will explain what was the ambition and the objective by developing those research needs, and I will finish by briefly explain you the presentation in this webinar. But first, I will start with PARC, which is the starting point of the development of those research needs. For the ones that are not familiar with, PARC is a public partnership under Horizon Europe. This is an initiative where the European Commission and the Member States, together with public partners, have committed to jointly support the development and the implementation of a research and innovation program in the field of the chemical risk assessment. This is a partnership that started in May 2022 and that will last for 7 years. It has a budget of 400 million euros which are co-funded by the European Commission and the member states. It is involving around 200 institutions from 28 countries, and this also includes the 3 European agencies, EFSA, EEA, and ECHA. Within PARC, we have around 80 projects ongoing, which are including also case studies, and the scope of those projects are quite broad. Some of them are generating new data for specific substances, others are working on the development of new tools or methods, but all in the field of the chemical risk assessment. The overall ambition of PARC is to facilitate the transition to a new generation of chemical risk assessment. And to achieve this ambitious goal, the project needs to address the regulatory challenges that the authority are facing. And early in the beginning of PARC, the agency have noted that there was a need to clarify what were the regulatory challenges. To be able to clarify those regulatory challenges and to explain it to the research community, the agencies needed first to identify and to develop the missing key elements in the scientific areas. When it was identified, we needed to communicate it to the research community. The purpose was for them to be able to understand what we need, and we also hoped that this communication will help them to be inspired and to improve the potential ongoing project, but also to promote new projects via the document that the agency have developed. And the whole objective of this exercise is to bridge the gap toward the research community. So bridging the gap is really the key element in this whole exercise. As I just explained, from the regulatory world to the academia, we wanted to clarify what was the regulatory context with this limitation and where were the regulatory challenges. But we need the support from the researcher, so there is a need to bridge the gap between the researcher, from the researcher to the regulators to address those regulatory challenges. And we need the research community to develop projects that are generating new data or developing tools and methods that are ready to use in the regulatory context. So this whole exercise of bridging the gap is to connect two worlds, so the regulators and the researcher, to be able together to address the regulatory challenges in the chemical risk assessment field. And this brings me to the concrete research needs that were developed by the agencies. So in June 2023, for the first time, the 3 agencies have presented their regulatory needs. 1 year later, we have realized that there was a need to clarify some of the research needs and to detail a bit further some of them. So this is now what you will see in this today's webinar. You will first hear EFSA presenting a topic on the new approach methodologies to advance risk assessment. Then you will hear a presentation from EEA on the monitoring field. And from ECHA side, we will present the bioaccumulation topic. So those topics have been selected for this webinar, and they are reflecting our legal mandates that are slightly a bit different, but all the 3 agencies are working together for the same goal and the same ambition, which is the improvement of the protection of the human health and the environment. If you want to know more, we also have our key areas of regulatory challenges, which is available on ECHA website, and you can see the other topics that we have developed as well. And finally, I will conclude by telling you that you will hear an interesting presentation on the topic that were selected for this webinar. However, you may need further information because this webinar is aimed to give you a first introduction. And in case you want to have further information or want to clarify some of the questions you may still have, I will really encourage you to reach out to us for that purpose. With this, I would like to wish you a good webinar, and I thank you for listening.
Hi everyone, today I'm going to talk about new approach methodologies to advance EFSA's risk assessments. My name is Jean Loudon and I'm the lead expert at EFSA on new approach methodologies. First of all, I'd like to highlight the NAM strategy at EFSA with goals and actions. First of all, the first goal is to develop and integrate NAM-based approach for regulatory risk assessment in terms of quality matter, with actions to launch experimental case studies for filling data gaps identified in EFSA's risk assessment using NAMs. Second goal is to ensure more informative risk assessments, mostly targeting on human health risk assessment. And here we define in parallel the midterm strategy, development of a roadmap for action that we have published recently. Make use of wider, improved and new data streams, such as big data, including omics. And of course, increase international cooperation with sister agency, the International Network on Accelerating the Pace of Chemical Risk Assessment, the ILMERAC Working Group on NAMs, the PARC project at the European level, and ECVAM, the European Center for the Validation of Alternative Methods. I would like now to move to where NAMs can be integrated in the risk assessment process. We have the hazard identification and hazard characterization step, the exposure assessment step, and the risk characterization, bringing the hazard dimension and the exposure dimension. Of course, NAMs are really relevant in terms of toxicology. So we have in vivo hazard assessment based on in vivo studies versus NAM-based hazard assessment, such as in vitro concentration response. We then have a dose response in vivo, which can be compared with a concentration response, such as ED50 or benchmark concentrations. We can derive from this dose response modeling a point of departure, which can be derived either from in vivo or NAM-based data. And of course, complementary information that will be very important, such as absorption, distribution, metabolism, excretion, characterization, pharmacokinetics, biokinetic data, quantitative in vitro in vivo extrapolation model, and physiologically based kinetic models. So a common approach for NAM implementation in risk assessment, as we have highlighted in the previous slide, we have the toxicodynamic dimension where we identify a point of departure. We use a weight of evidence approach, bring the adverse outcome pathway into the game, and the IATA. So we need to understand what we're testing for. And of course, from the toxicokinetic dimension, integrate the point of departure with internal dose for risk assessment. We have 10 NAM projects at EFSA that are clustered, looking at environmental neurotoxicants and brain health, neurodevelopmental toxicity. We have a project on NAMs for nano, which involves, of course, studying the toxicity of nanomaterials using NAMs. Integrating NAMs into chemical risk assessment using the TK plate platform, which allows toxicokinetic and toxicodynamic modeling of chemicals. Another project on interindividual variability in toxicodynamics. NAMs for risk assessment of chemicals in food with a number of case studies, including essential oils, but also perfluoroalkynes. And the practical implementation of NAMs when it comes to the risk assessment of pesticide metabolites. In addition, projects on adverse outcome pathway development, protein safety, and also transcriptomics, such as the TXJMAP project. Research needs. We are looking at in vitro and in silico ADME and PBPK models implementation in practice, micro and nano-sized material, uniform approach to identify harmful chemicals such as neurotoxicants, immunotoxicants, endocrine disruptors, phasing out of the animal testing, looking at IATA case studies for read-across and NAM-based approach, in vitro in silico testing battery for target organs and chronic toxicity, omics-based technology, in vitro and in silico testing battery for DART and other endpoints such as developmental neurotoxicity. Protein safety, NAM-based testing framework for novel food components, and implementation of analytical methods. The TK plate is highlighted here with the workflow on the right-hand side. You can see that the TK plate allows to model in humans and animals what the body does to the chemical, which is the toxicokinetic, and what the chemical does to the body, which is the toxicodynamics. So the workflow of the TK plate is basically an input module where you would choose the model, exposure, and time scenarios, whether we have a single exposure or multiple exposure, and a number of models can be run, such as forward dosimetry from external dose to internal dose, reverse dosimetry for human biomonitoring data, where you would go from internal dose to external dose, a toxicodynamic module which allows benchmark dose modeling or dose response modeling, a DEB module for dynamic energy budget module for the ecotoxicological dimension, and a mixed tox module which allows to perform risk characterization of risk assessment for multiple chemicals such as mixtures. You then have an automated report which is generated together with graphs and data sets. So looking at synergies between EFSA, ECHA, and European projects in terms of research needs, generate in vitro kinetic data to calibrate these PBPK and QIVV models, absorption, distribution, metabolism, transport, and excretion. Importance of data requirement for kinetic data to integrate such data and calibrate models for regulatory purposes. When it comes to the modeling, again, we're looking at in vitro parameters to calibrate and run these models. We need a mapping of all the models which are generated by, for example, the PARC project and the ASPIS consortium to identify their relevance for risk assessment. Generic PBK models are of interest for the TK plate platform, and they can be integrated through synergies between the researchers and EFSA. Human biomonitoring data and reverse dosimetry to perform aggregate exposure. Quantitative adverse outcome pathways can be integrated in risk assessment. For example, under the ASPIS consortium, there is a lot of work done on steatosis. So we can link this PBPK and quantitative in vitro, in vivo extrapolation model and benchmark dose modeling. Another area of interest for EFSA and ECHA are bioaccumulation models that can be integrated, and TKTD model for ecotoxicological risk assessment. With regards to exploring the use of omics in risk assessment, so we have a genomic signature as a toxicity surrogates in humans, for example, using transcriptomics, metabolomics, and epigenomics. Standardization validation, which is essential for regulatory acceptance. Integrating signature data with traditional toxicological data to improve the predictive accuracy for toxicity pathways. And of course, modeling of dose response using, again, benchmark dose modeling and PBPK QIVV modeling. With regard to NAMs for environmental risk assessment, a lot of exploration is ongoing to look at the utility of NAMs for ERA, opportunities and challenges, to provide new data streams, provide alternative test systems, model species and endpoints, innovate and modernize the environmental risk assessment, providing improved mechanistic knowledge on toxic effects on biological systems, and of course, improve ERA efficiency, reliability, and realism to enable prediction of effects from the laboratory to the field, and from individuals to population, and across species to eventually move towards ecosystem. With this, I would like to thank you for your attention.
Hello, I'm Nadia Torioli, and I work for the European Environment Agency as a chemical expert in the BHR Biodiversity, Health and Research Program. I am part of Group 1, which is in charge of health environment tasks. This group is responsible for leading and coordinating the EA IONET activities on the environment and health, including air quality, environmental noise, and chemicals. The main activities include managing reported data and producing indicator assessments and information sharing tools, as well as networking activities. We also provide input concerning these topics into the EEA thematic sectoral and cross-cutting assessments, and lead the European Topic Center on Health and Environment. Today, I'm here to present you the EEA perspective on chemicals research needs, with more intense focus on human health and the environment. The EA is an European agency founded in 1994, and this is the 30th anniversary of the foundation. There are more than 2,080 employees, and it is located in Copenhagen, Denmark. The EA is not a typical regulatory agency, but we assess the state of the environment, including the impact of chemicals, assess the cross-cutting and systemic challenges, inform on policy implementation, and offer a network for exchange of data and knowledge. The occurrence of chemicals in surface water, drinking water, soil, air, biota, and human health is a key in order to provide data on real exposure levels from multiple sources, estimate impacts on ecosystem and human health, evaluate the state of environment, validate information from upstream chemicals regulation like REACH, PPPs or BPR, for example, and target policy intervention to substances that matters. The EA has prepared an internal document about the research needs in field of its remit, and various areas of interest for filling knowledge gaps has been identified. In these slides, you can see that we identified many areas, but today we will focus our attention on the first two areas with the final example of cross-cutting topic. About environmental research needs, one of the topics identified by the EA is about the effect and the spreading of antimicrobial resistance, in particular investigating the link between environmental quality standards and the minimum inhibitory concentration of an agent that inhibits growth. We are all aware that antimicrobial resistance has become a top concern in recent years. While research is advanced in health and food sectors, environment seems left behind. A key and unknown risk is that antimicrobial resistant or antibiotic resistant genes can be transmitted through the environment and back to the people. Now, antimicrobial resistance is not covered in water legislation, but the proposed revision of the Human Wastewater Treatment Directive would bring in monitoring at large urban wastewater treatment plants. The proposed revision of the Water Framework Directive, the Environmental Quality Standards, and the Groundwater Directive would add antibiotic-resistant genes to watch list for emerging pollutants, but the timeline for this revision is unclear. Antimicrobial resistance is measured, for example, as a minimum inhibitory concentration, but not exclusively. Instead, environmental concentration are measured, example given, in microgram per liter and assessed against the environmental quality standards. Understanding if there is links between these two quantities could hasten the implementation of the antimicrobial resistance standards in the environment. The research in this topic would find links between water quality, and antibiotic presence by coupling medicine, health, and water regulatory framework aspects. Climate change is already causing an increase in frequency of extreme events like droughts and floodings, and water stress is increasing. This puts further pressure on the remaining water, and over abstraction from groundwater is known to reduce the quality of water, example given through salinization. In the surface waters, there may be increasing concentration of pollutants if same loads are discharged into a lower volume. We know about the Odo River catastrophe in 2022. And moreover, flooding may lead to widespread release of pollutants with high dilution. We have a poor understanding of the impact of these sort of events on water quality except in the catastrophic events. So it is extremely important to investigate water and chemicals related climate changes. The persistent organic pollutant in European soils is another topic of great interest. The EA has been tasked to monitor progress toward the zero pollution targets, while for soil pollution, indicators and or assessment are largely lacking. This project will deliver a working paper including the current knowledge about the exposure and biodiversity and ecosystem effects of POPs in soils across the Europe. The report will be based on a review of large-scale studies and case studies from academia and agency, as well as research for data with the goal of mapping POPs contamination in soils and possibly other matrices, for example, suspended particles in surface water, and moreover, their impact in the Europe, across the Europe. The European Commission has proposed and adopted an ambitious strategy as a core of a European Green Deal, with the aim to decrease that pressure and to ensure better protection for human and ecosystems, such as the biodiversity strategy with its legally binding nature restoration law, farm to fork strategy, as well the soil strategy. In particular, the EU soil strategy contributes and reconfirms medium and long-term objectives that are relevant and linked to soil health, while long-term zero pollution objective is the reduction of pollution in the soil to the levels no longer considered harmful to human health and natural ecosystems, thus creating a toxic-free environment. Studying and better understanding of the environmental degradation pathways for polymeric PFAS could drive to fill a gap in research on these compounds. As known, polymers are exempted from registration under ECHA regulation. This means that we have limited information on identity on PFAS polymers that are in use and on the potential for these polymers to enter in the environment and to be degraded into smaller PFAS compounds that can be taken up by living organisms. Hence, more research is needed to understand the potential long-term impacts on the environment exposure to PFAS polymers. Many different PFAS degradation compounds may in theory be created, and it is therefore necessary to develop and use analytical methods that are able to detect other PFAS compounds than those are typically included in the environmental monitoring program. PFAS polymers may serve as continuous source to release of PFAS degradation products, which potentially could pollute soil, surface water, drinking water sources, and food sources. The topic hence links with a number of key EU chemical legislation. About the research needs that the EA identified in the human health area, one could be to further harmonize the approaches for human biomonitoring in the EU. In order to create a high-quality dataset which can be compared among different countries and time periods, it is necessary to use comparable approaches and methods for collecting and processing the data. This work is already an important part of the PARC partnership, but the work still needs to be prioritized and further developed in the coming years. Human biomonitoring is important to understand on the actual exposure from different sources to select priority compounds of concern. There are currently no regulatory requirements for human biomonitoring in the EU. Nevertheless, significant resources are used on the topic from a number of member states at national level, which is often co-funded by the EU via research program, example given PARC system. Under the CSS, the Chemical Strategy for Sustainability, one objective is also to minimize exposure of humans and the environment to substances hazardous to health and the environment through risk management measures and full information to users of chemicals. This proposal, the proposal in this slide in particular, is intended to identify substances of concern that could negatively affect the quality of indoor air and the dust too. In fact, at the EU level, there are many data gaps and limitations on the monitoring performed by the member states on this topic. And so increasing monitoring studies can grow the knowledge on the diversity of chemical posing a risk to human health in indoor air and dust. We want also to mention the EFSA contribution of the human biomonitoring topics. Over the years, EFSA has acquired a solid expertise in the use of food monitoring data and the modeling dietary exposure. Meanwhile, significant progress has been made in the field of human biomonitoring, and despite human biomonitoring data may also refer to non-dietary exposure, there is an increasing need for EFSA to understand how such data can be used to complement its current approaches for assessment of risks associated to chemicals in food. In the first instance, further work is needed to ensure access of human biomonitoring data. While it is appreciated that such data are privacy sensitive, EFSA underlined that access to aggregated published data is often not sufficient for a detailed analysis. Efforts are needed to allow for access to the individual data while ensuring data protection for the survey participants. Furthermore, clear criteria need to be developed to identify new hazards that may be relevant to EFSA and define how new and existing hazards may need to be prioritized by EFSA based on the human biomonitoring data. This data may also provide valuable information on how exposure estimates obtained by this agency through exposure modeling practices relate to exposure indicators measured in population. Further research is therefore needed to frame the use of human biomonitoring data for validation of dietary exposure models. As a final step, human biomonitoring data may also complement exposure estimates obtained through dietary exposure modeling in view of an overall risk characterization. Considering that both approaches have their advantages and limitations, methodological approaches are needed to combine these two lines of evidence into one comprehensive risk assessment. And now, a not-crossing argument with an example of highlighting the opportunities that could be offered by a different approach. We can look at the role and alternative modes of no-chemical delivering function. The Safe and Sustainable by Design framework from the Commission proposes a framework to reassess the safety and sustainability of chemicals and materials at the designing phase. And it can ensure that the chemical or material does not adversely impact human or the environment via its use or its production. In this context, looking at non-chemical alternatives to achieve certain function, to replace, example given, a substance of concern, can be an opportunity to avoid unnecessary risks. Research in this direction could increase knowledge on opportunities for avoiding substances of concern in chemical production and uses. As a final message from our side, we want just to underline that it is fundamental filling data gaps and giving evidence through researches, both in human health and the environment. And this can improve science and policy interface that are fundamental to go in the right direction. So thank you for your attention.
Hello and welcome. My name is Jane Cayley. I work in the Hazard Assessment Directorate at the European Chemicals Agency. I'm going to talk to you today about ECHA's research needs for bioaccumulation assessment, and it's explained in more detail in our published report on key areas of regulatory challenge. And the aim of my presentation is really to inspire researchers to focus on the areas that I'm going to talk about. Okay, so the content, I'm going to set the scene, explain a bit about how we use bioaccumulation data in ECHA, and then I will describe the 4 areas of research that we see the need for. So bioaccumulation in air-breathing organisms, for superhydrophobic substances, for surfactants and ionizable substances and organometals, and finally, alternative methods in bioaccumulation assessment. So moving to setting the scene. Here I'm going to talk about what is bioaccumulation and how we use the data. So bioaccumulation is really key to understanding environmental fate and behavior of chemicals. It can occur in aquatic food chains and terrestrial food chains, and it's the net result of uptake of a chemical into an organism, followed by its distribution and its transformation, and then its elimination from the organism. And we use data on a very few wildlife species to predict bioaccumulation in the whole environment. And chemicals which bioaccumulate cause 2 main concerns. The first is that bioaccumulation in an organism can lead to an internal concentration, which causes toxicity in the long term. And the second concern is a substance can transfer through the food chain if it bioaccumulates in one organism. So now I've set the scene, and a little bit more about bioaccumulation and how we assess it. It's usually driven by lipophilicity, which is the ability of a substance to dissolve in fat. And we use the octanol water partitioning coefficient to predict the bioaccumulation potential. But this doesn't always work because some substances accumulate in other compartments than lipids, for example, protein, and some PFASs bioaccumulate more to protein. For the aquatic food chain, many regulatory criteria are based on the BCF, the bioconcentration factor for aquatic species. And we also use biomagnification factors, BMF, and trophic magnification factors, TMF, in our bioaccumulation assessments. For the terrestrial food chain, for air-breathing organisms, we have another criterion. We also use the octanol air partitioning coefficient, which predicts those substances which could be eliminated easily by exhalation. And now I just give you a brief overview of the regulatory criteria. So you can see here that they are mainly based on BCF, the bioconcentration factor. So we have criteria in the top left for PBT and VPVB assessment or classification, so persistent bioaccumulation, toxic, or very persistent, very bioaccumulative chemicals. And then the screening criteria based on log KOW and KOA. For the Stockholm Convention on Persistent Organic Pollutants, again, there's another BCF threshold and log KOW threshold. We also consider bioaccumulation data when we're doing risk assessment, so secondary poisoning and humans exposed by the environment. And we also consider bioaccumulation data for classification for hazardous to the aquatic environment. So now I'm going to present our key research needs for bioaccumulation assessment, starting with bioaccumulation in air-breathing organisms, in mammals. So some substances do not bioaccumulate in the aquatic organisms. They have a BCF below the regulatory thresholds, but they still have a potential to bioaccumulate in air-breathing organisms, such as the ones pictured here. And one example of this is the chemical BCPS, we see in the right-hand box. It has a BCF in fish of 82, so it's low. It doesn't meet any of the regulatory thresholds, but it screens for potentially bioaccumulative in air-breathing organisms with its log KOW more than 2 and log KOA more than 5. And in a toxicokinetic study, it has a very long terminal half-life in rats of 12 days. And it's been found to biomagnify in some food chains, fish seabirds and fish seals. And actually, this substance has been identified as very persistent, very bioaccumulative, according to REACH Article 57E, because of its bioaccumulation potential in air-breathing organisms. So moving on to our research needs. So the first need we see is for improved screening criteria. I mentioned this criteria of log KOA being greater than 5, but recent research shows that it may not be protective for some types of animals, those with low respiration rates, those with high lipid diets, and some reptile species. So there's a need to investigate the adequacy of these screening criteria. And the next research need is for biotransformation assessment. So as a key step after a substance is being screened as bioaccumulative in air breathers, we need to do some further investigation. And in vitro methods, in vitro clearance assays, and QSAR methods may be one way to predict the biotransformation potential and then weed out those substances which don't screen as bioaccumulative in air breathers, so those which are expected to biotransform rapidly. And if you look at this chart in the right-hand side of the slide, you can see there the chemical space, this area in orange, which is the area that would be captured by the log KOW more than 2 and log KOA more than 5. So actually a lot of chemicals would meet these screening criteria. They're not very specific, and we need a way to further prioritize those substances so we don't have to test them all in higher tier testing. Other research needs are determining hindered uptake for air-breathing species. So some substances may not bioaccumulate in air breathers just because they're not taken up. We need criteria for that. We need to expand the concept to other air-breathing species. Currently, we only have a methodology for mammals, but for example, birds could be included. And we use monitoring data, biota monitoring data for bioaccumulation assessment, and we need high quality monitoring data and good methodology for assessing the data. So that's the end of the research needs for air-breathing organisms. Now I'm moving on to bioaccumulation of super hydrophobic substances. Okay, super hydrophobic substances are those with a very high log KOW. And it used to be considered that they are they have less potential for bioaccumulation because they have low bioavailability. And you can see from the graph on the right, which is a plot of log KOW on the x-axis versus log BCF, that as the log KOW increases, BCF increases until a certain value of log KOW is reached, and then BCF is expected to reduce. But some substances have been found to behave differently than this. D-chlorane plus is a substance which is listed under the Stockholm Convention as a persistent organic pollutant and identified under REACH Article 57E as very persistent, very bioaccumulative. Even though it has a log KOW more than 9, it has been found to biomagnify in some freshwater and marine food chains. For these types of substances, it takes a very long time to reach steady state. They're taken up very slowly, they're eliminated very slowly. So because of this, they're difficult to handle in a laboratory, and they're difficult to test over the usual time period of laboratory tests. So our research needs for these substances: we would like to know when we can use a standard assessment approach for superhydrophobics, how we can predict whether they will bioaccumulate or not, and what parameters and test methods we can use for these substances, and are there suitable laboratory tests, for example. So really we need an approach to screen and assess the bioaccumulation potential of superhydrophobics. So moving on to the next research area, which is bioaccumulation of surfactants, ionizable substances, and organometals. Log KOW is not a good predictor of their bioaccumulation potential. And when I talk about ionizable substances, I mean those that are ionized over the environmentally relevant pH, which is between pH 4 and 9. Such chemicals may have specific binding interactions, like for example with proteins. They may have specific mechanisms to transport across cell membranes, and their behavior is difficult to predict. We noticed that for cationic substances particularly. And just to note that the standard data requirement for a BCF test under REACH cannot be waived just based on low log KOW if a substance is surface active or ionizable. So we want to avoid unnecessary testing of those substances. We need some kind of screening approach. So I'm moving to the research needs for these substances. As I mentioned, screening criteria. We need a way to predict whether they will bioaccumulate. For example, recent research has shown that a fish water partition coefficient or the membrane lipid water partition coefficient may be useful for this, but further work is needed, and we need thresholds to screen these chemicals in or out as bioaccumulative or not. And further research is also needed on the mechanisms by which such substances bioaccumulate. So the final research topic is alternative methods in bioaccumulation assessment. So by that I mean alternative methods to the OECD 305 test guideline, the fish bioaccumulation test, which uses a lot of fish. But there are already alternative methods available. The OECD test guidelines 319A and B on fish clearance rates use much fewer fish, and they're in vitro studies. And they can be used to generate a BCF by in vitro, in vivo extrapolation models. And there's also a new OECD test guideline in invertebrates, Hyalella azteca, which is pictured here. And this will very soon be published. And it is already possible to use these studies for bioaccumulation assessment. So what are our research needs for alternative methods? Well, as I mentioned earlier, we need improved indicators of bioaccumulation screening methods for for the ionizable surface active and organometals, and for air-breathing organisms. And that will help to avoid higher tier testing where it wasn't necessary. It would help to screen out substances which actually aren't bioaccumulative or aren't predicted to be bioaccumulative. And then for the in vitro clearance assays that I mentioned, the OECD Test Guidelines 319A and B, we need further experience with these methods. We need to know what type of chemicals they work for. We've noticed that there's sometimes a mismatch between the BCF predicted by these assays and that measured in the fish bioconcentration test, and we need to know why. The IV-IVE models to predict BCF need to be improved. And it would be really great if we could have in vitro clearance assays for other species, not only fish, but for example, rats and birds, and that will help predict bioaccumulation in air-breathing organisms. So now I just very briefly show you a list of information sources for this presentation, and you can find more in the report on key areas of regulatory challenge. So that is the end of my talk. I have given you an overview of the 4 key areas that we think need further research and would really help ECHA to make better regulatory decisions. So I hope I've inspired you to have a look at these topics, and we're very happy to answer your questions very soon in our live question and answer session. Thank you.
We've come to the end of the presentations. Thank you again to all our presenters. Now, before we start the live Q&A, let me summarize the key takeaways from the presenters. First, we heard how important it is to bridge the gap between the research community and regulators. Regulators need academia to develop projects that address their regulatory needs and deliver data and tools that are ready to be used in the regulatory context. We also heard how the PARC initiative is making great strides in bridging this gap between research and regulation. This effort promotes new methodologies and data integration that are crucial for advancing chemical risk assessments in both EU and national legislation. EFSA gave us an inspiring presentation of how they're pushing forward with a call for more new approach methodologies and how these methods help us reduce reliance on animal testing and improve the accuracy of our predictions. Then, the EEA explained how they're focusing their attention to more research on environmental and human biomonitoring, addressing important issues like antimicrobial resistance, the impact of persistent organic pollutants, and the effects of climate change on water quality. Now, in terms of bioaccumulation research, ECHA is calling for more work to refine screening criteria, develop new in vitro assays, and enhance predictive models. These efforts aim to improve regulatory assessments for bioaccumulation in various substances. Now, to conclude, I want to stress that collaboration and innovation are key. Cross-agency and international partnerships are essential for driving progress. By leveraging these synergies across EFSA, EEA, and ECHA, we can advance innovation and significantly improve chemical safety. And to do this, we really need you, the research community. We need you to consider what you've heard today and what you can find out in our key areas of regulatory concern report to really tailor your research so that it can have an impact on regulatory science. So with that, it's nearly time to start our live Q&A. As mentioned at the start, you can send us questions through Slido using the QR code on this slide, or by going to slido.com and using the event code SCIENCE2024. The live Q&A lasts until 1, after which we end the webinar. Remember that if your question is not answered by the end of the event, we will publish a Q&A with answers to all the questions soon. So, I'll now hand over the floor to Fleur van Broekhuizen from ECHA, who will be moderating the Q&A, and the experts who are here to reply to your questions. We'll start shortly.
Good day, good morning from my side, and welcome to this live Q&A. I'm Fleur van Broekhuis, and I will be moderating today's discussions. I'm part of the team in ECHA coordinating the development of the research needs. And with me is a panel consisting of experts from ECHA, EFSA, and EEA that are here to answer your questions that you will ask to us today. From EFSA side, we have Jean-Luc, Bruno, and Andrea. Magnus is here from EEA side, and from ECHA, we have Doris, Jane, and Wim. So thank you all for joining. Before we start with the questions, I would like to thank you all for sending your questions in advance. We will soon start with taking some of those first, and then take a mix of questions that you have sent before this Q&A, but also those you may want to send during the discussions. So please, if the discussions arise further questions from your side, please know that you can send them in from Slido. All questions that will not be addressed during this live Q&A will be answered and uploaded to our website after the meeting. This may take a while because of the upcoming summer breaks, but it will be done as soon as possible after the summer break. So with this, let's get started with the questions. First question from PETA, Science Consortium International. What research initiatives are the agencies undertaking to maximize non-animal methods for fulfilling endocrine disruption classification criteria, considering the introduction of new hazard classes in CLP? This question, who can I give the floor? Andrea, would you like to start?
Yes, thank you very much, Fleur, and thank you, Peter, for this question. Indeed, the current legislative frameworks for the identification of substances having the potential of inducing endocrine disruptors is highly focused on animal studies. So that's indeed for the non-EATS mediated modalities, so the ones that are not mediated by perturbation of estrogen, androgen, thyroid, or steroidogenesis modality. The challenge is both for the identification of the activity, so methods and understanding of the endocrine activity, as well as for the hazard. So that is definitely the most important scientific challenge. For the modalities like estrogen, androgen, steroidogenesis, and thyroid, where we have gained much more experience and several methods and systems are available for the endocrine activity, what is critical now is to finalize the ongoing or developing the new one adverse outcome pathway, identify critical node events that are measurable and possibly quantifiable. So we need this quantification in order to understand the dynamic range of the perturbation of the various axes that are eventually of such a magnitude to trigger the hazard. So that's our, for the endocrine disruption part, certainly area of challenge.
Mm-hmm. Thank you, Andrea. Wim, would you like to continue?
Yeah, I think it's a great question indeed. With this advent of new hazard classes, there's indeed a lot of activity and a lot of needs. In addition to what Andrea just said, indeed, the needs that we have developed in our document as key areas of regulatory challenge, they're basically reflecting the same priorities. In a way, what we're currently doing is, in PARC already, we're supporting those projects that are working on NAMs and ED, specifically to optimize their potential future regulatory uptake in relation to ED. And just to summarize briefly what these are is, of course, we believe that there's an urgent need to develop new or improve existing assays, NAM-based assays for the EATS and the non-EATS modalities. We've clearly also flagged the need for example, more ED-related quantitative AOPs. We believe that there's an urgent need for that. when we dive a bit deeper into what's ongoing, for example, in PARC, we have a particular attention to the use of defined approaches over broadly describing IATAs. So we believe there's an urgent need for those. And last but not least, I think we are also following that is the NAMS development for invertebrates, because we believe the invertebrates, of course, are a very important class of organisms looking at biodiversity ecosystem-wise, and we have a very, very underdeveloped set of assays, and we believe that this is important also from a One Health perspective, that we're not only looking at vertebrates but also at invertebrates. So yeah, indeed, that's, I think, for us the most important needs and activities for the moment.
Thank you, Wim. Thank you for this addition as well. Anyone else would like to add on this question? No? Thank you. Thank you for this very, very comprehensive answer. Then we continue with the next one. Again, from PETA, Science Consortium International. What do the agencies need to see before a TK plate is ready for risk assessment? Andrea.
Yeah, I mean, and I will also ask support to my colleague Jean-Loup, which is the father and creator of this TK plate. I mean, of course, the quality of the outcome of the TK plate of any model in general, it really depends of the quality of the input data. I mean, for us, that we are start using this modeling to select point of departure, so coming from an in vitro study from NAM to an external dose, the ADME and the ADME parameters and the chemical physical properties and protein binding, that's are essential data for which the quality will make a big difference. That is the reason why we are also developing a bespoke model starting for the TK plate or similar modeling, like for example the application of the ADME parameterized QIV and external dose and reverse dosimetry for the developmental neurotoxicity ABB, so to transform an hazard from this complex in vitro system to an external dose. But of course, you need quality data in the input. And I pass the floor to my colleague Jean-Loup that can certainly be more specific on this.
Thank you very much, Andrea. Well, so just to maybe summarize what the TK plate does, it allows you to basically predict toxicokinetic properties of chemicals, whether they're coming from in vivo sources or in vitro sources, but also dose response modeling. When it comes to the QIVV, we have implemented also extrapolation factor for hepatocytes and microsomes to calculate in humans, but also in all the test species, the quantitative in vitro in vivo extrapolation. So it allows the user to basically perform this extrapolation. However, again, and as flagged by Andrea, one of the issues is the availability of the in vitro data to actually parameterize these models. So we are currently working on testing using real life scenarios at EFSA, the prediction power, so to speak, of the models within TK plates through comparing the performance of the generic models that are implemented in the platform with chemical specific models. And actually what we find is that for chronic exposure, the generic models perform actually quite well. Still remains to be tested for very persistent compound as discussed previously, and also the implementation of maybe bioaccumulation models, which have been identified as a priority for both our agencies. Thank you.
Thank you. Thank you both. Going to the third question from PETA. Do the identified research needs for polymers primarily aim to develop NAMs as screening tools to select polymers for animal testing, or are there initiatives to definitively assess polymer hazards for classification solely using NAMs? Who would like to start on this one?
I can start because from the EFSA perspective, polymer and then pass the floor to Wim, because from the EFSA perspective, NAMs polymers are not a priority, but I think what is described in the CARC document is pretty clear. That's the research should focus bioavailability, stability, and understanding the hazard property of polymers. Without this understanding, it is very difficult, at least from our side, to indicate how best to proceed in using mechanistic understanding on new approach methodology to assess them and to characterize the hazard. I mean, I think the CARC document pretty well reflects the reality of the needs. But please, Wim, I guess you can reinforce this message.
Yes, thanks, Andrea. I think indeed polymers, of course, is a hot topic. Towards the end of the current commission, basically, there's been a lot of discussion to, let's say, work on a legal framework to assess the hazards of polymers, and there's a lot of discussion ongoing on about. On the basis of that discussion, we've indeed prioritized the needs that we immediately see. The key properties we believe are to assess how bioavailable these polymers are, their breakdown products, in terms of stability, but also understanding the hazard properties, both for human health and the environment. And when we look into these provisions, of course, we foresee there's a lot of power for NAMs in that framework. And of course, for the moment, our ambition is to use NAMs as wide as possible in a range of applications. That means let's start to use NAMs to prioritize and screen the most, let's say, hazardous, or at least the polymers of concern, and where possible also allow NAMs for risk assessment. There's nothing that says that it cannot be done. Of course, in your question, I see you want to also maybe suggest classification of polymers on the basis of NAMs. That's probably going to be a long jump for the moment, right? Because classification, as it is done for the moment, is based on the basis of adversity, as you know, meaning reduction of apical endpoints like growth, survival, reproduction, and how far NAMs can be used immediately for that purpose, that remains to be seen. But at least for the moment, we believe we should, let's say, invest in as much as possible in NAMs to assess the hazards and risk of polymers on the basis of NAMs as much as possible. Yeah.
Thank you, Wim, and thank you also, Andrea, for clarifying this further question. Next is a question related to bioaccumulation. Question is, considering the different areas that are still regulatory challenging in the field of bioaccumulation, which one has the highest urgency and the largest impact on human and environmental health? Jane, can I start with giving the floor to you? Yeah.
Yes, you can. Thank you. Yeah, it's very hard to say. I think for the superhydrophobic substances, we know that some of them have already been seen to bioaccumulate in the environment. And there was this long-term view that they weren't bioavailable, but for example, chlorinated paraffins and some flame retardants we found in biota. So we found that they do bioaccumulate. So that would be one priority area to try to develop more techniques for the superhydrophobic substances. Also with these new approach methods like the OECD 319 AB fish screening clearance assay, it's a fast way to screen and identify substances, whether they metabolize rapidly or not. Maybe it has good potential in the future to faster assess the substances, so we have a bigger impact.
Thank you, Jane. Magnus, would you maybe from EA's perspective like to add?
Yes, certainly. So from the EA side, we have a little different perspective, given that we do not do risk or hazard assessment like ECHA and EFSA, but nevertheless, we are still very much interested in this topic. And seen from above, you could say that at the EU we have quite a protective framework of chemical legislation. But I also think that the presentation from Jane before showed that there perhaps are sometimes certain chemicals that can slip through the safety net, where we afterwards find out that they perhaps pose a risk, even though they were not caught by the REACH registrations or EFSA assessments and so on. And this could be due, for example, to our methodologies not being good enough to capture some of these substances. And for bioaccumulation, we also saw some examples here. So if at the EU level, there is this legislative proposal out now on to establish an early warning system for chemicals, with the aim of actually trying to capture some of these substances earlier in the process, before they have polluted our ecosystems and human bodies. And if adopted, this system will be established by the EA. And here, of course, we need to have good ways of identifying early signals of emerging concerns. And here I think having methodologies that would point us in the direction of some of these substances is of high interest to us, also in regards to research needs.
Thank you, Magnus. Thank you. Next question is from Walter Waldman, and he asks, what are the expectations regarding regulations on micro and nanoplastics, and which kind of research regarding this topic is more urgently needed so the agencies can figure out the best and fair regulation? Who would like to take this?
I can start and then pass to Wim. Yes, EFSA. In EFSA, we are currently investing quite a lot of resources for the risk assessment of nanoplastic, microplastic, and nanomaterial. The selected approach is to use qualified NAMs and use NAMs for screening, identify the hazard and assess the hazard. So we have a guidance. The guidance is already proposing a number of NAM-based endpoints, and we have also an external contractor that is delivering and will be published very quickly a qualification system for the NAMs. Of course, the analytical and biodistribution characterization are fundamentals. So understanding this step is a fundamental step for the risk assessment of nanomaterial. But then we have also the hazard part. I mean, the hazard part, the critical aspect for understanding the hazard of the nanomaterial is lacking a knowledge and an understanding of the sensitivity of the test method and the test systems. So basically all the endpoints that are proposed are supported by test method, test system, for which we have a training set of chemicals that are positive and recognized positive and recognized negative, but they are not nanoparticle. So that is a critical challenge. So it's the same challenge that is existing with the animal. You can pack a rat of nanoparticles, nothing happens, so it's not informative at all. And the same position is now true, at least for the large majority of the endpoint that we put in the guidance. So I would say that the nanoparticle nanomaterial is the good examples where we have a concern, and we don't have an in vivo methods that can realistically provide information on how to assess, and NAMs are likely to be the best option. But in any case, NAMs, at least at the moment where we stay, need to be corroborated by information on the analytical and the biodistribution information. We have also projects that are going to start, and some already ultimated on case study, just because we want to provide with a kind of IOP-informed IATA that can eventually be the exemplificative good practice, so people can use this IOP-informed IATA to understand what are the best practice to characterize the nanomaterial and nanoparticle.
Thank you, Andrea. Wim, would you like to continue?
Yeah, I can definitely add an ECHA perspective, because expectations regarding the regulation of micro and nanoplastics, indeed. On microplastics, there has been quite some work done already. So in the last couple of years, the Commission had asked ECHA to look into the possibility to restrict intentionally added microplastics. So that came into force end of last year. But besides that, indeed, we pay particular attention from the polymer side, as I said earlier. So currently, as you know, polymers are exempted in terms of registration under REACH, and there's a lot of discussion ongoing whether they should become we should work towards a REACH for polymers, but that is currently not decided yet. And that's on that basis, actually, we have provided our research needs in the CARC document, as we mentioned earlier. So what we urgently need is a method for bioavailability, stability, and hazards. I'm not going to repeat that. That was addressed earlier. When it comes into the specific nano aspects of nanoplastics, we think indeed those are the same as for nanomaterials in general, and we've also listed that in our CARC document. So basically, although there's quite some development already happening in test method development, OECD-wise, so standardization of test methods, there's still a huge delay in terms of test methods. So we believe also there's a potential for NAMs to better characterize and screen properties of nanomaterials. Also, characterization in light of toxicokinetics, toxicodynamics for nanomaterials, that's definitely underdeveloped. Methods to determine their biodegradation potential is definitely something to look into. Absolutely important are the long-term effects of nanomaterials, nanoplastics, and also urgently needed are new methods to assess the bioaccumulation, because we know that the uptake of these particles are not necessarily following the paradigms that we have in place for, let's say, the more traditional chemicals. So also there, we believe there's an urgent need to look into that. So please have a look on the nanomaterial section in the CARC document, because this elaborates it also there in more detail. Yeah, thanks.
Thank you, Wim. Many different angles to this. Magnus, I see you're unmuting yourself.
Yes, I mean, from the ESI, we are normally mainly looking at the occurrence, and we have also been looking into microplastics, and of course we do find it in the environment. We've been looking also to on the sources, for example, textiles and so on, to see where does it come from. And we have highlighted a number of knowledge gaps in the past, like on the different types of microplastics, but especially on their impacts. So it's very difficult to actually give an assessment on the impacts of microplastics currently. But as we do have reduction targets in the Zero Pollution Action Plan, it's something that we need to track over time, and we have also been trying to develop an indicator on this, which hasn't been possible due to knowledge gaps. So currently we have what we call a signal, which is a light model of an indicator where we can do some qualitative descriptions, but in order to base it on more valid data, we would need more knowledge on the impacts of microplastics. So this is also an area that have our interest.
Thank you, Magnus. Going to the next question asked by Emma, and maybe it's good to take this question in two parts. What is PARC going to do next for HBM for EU priority substances? And then as a second question, is ECHA going to proceed on an assessment of their regulatory needs? So maybe to start with the first one, and maybe Magnus, you would like to start on this one?
Yes, indeed. And I can say I'm also very much involved in the PARC program. So this is something that has, of course, very high priority for us. And we would really like to be able to track over time the trend for these priority substances. And that is exactly what we are going to get with PARC. So PARC started a few years ago, and in the beginning, time was devoted to, discussing the priority substances, but also new priority substances coming in, of course, and also planning for the human biomonitoring. So getting the protocols in place and so on. And now the different institutions are starting the monitoring programs. And you could say that the priority substances under HBM for EU will also be carried over under PARC. For most of these substances, you will have data from the same countries. Sometimes you will also have new countries joining in with human biomonitoring data that wasn't a part of HBM for EU. And in a few cases, there are also countries that have pulled out so that we won't get data from those countries under PARC. But it will be very interesting to see once the data starts coming in, and that will probably take some time still from now to be able to track the progress. And we have actually, from the EA side, we have currently 4 of these signals that are based on human biomonitoring data for HBM from EU, and we will be able to update those with new data. Currently, it's more of a baseline. We know the current level of exposure, but to track it in a number of years from now, examples are the bisphenols and also phthalates, for example, where we've had quite a lot of regulatory measures in between. So we are, of course, interested to see the effects of these regulatory measures. Can we also harvest the benefits in terms of reduced exposure to humans in the EU?
Thank you, Magnus. Super interesting. I would like to add. Yes.
Yeah, maybe can I add this assessment of regulatory needs angle? That's of course a very interesting one. But for those of you who are not familiar with that, what is an assessment of regulatory need? It's a concept developed by ECHA that we've actually been using as a screening exercise to explore the possible need for regulatory action on the basis of the information that's available on chemicals in registration dossiers. So to give an example, this is particularly useful when we have a concern for example, one substance, but we have at the same time a group of similar substances on which we know very little. And this assessment of regulatory needs helped actually then to prioritize this group of similar substances, a family of substances, to help prioritizing the next steps. So should we generate data, for example, ask for data, or immediately go to a regulatory action, or let's say down prioritize it because we're already working on it. And this is an approach that's been ongoing in ECHA since a couple of years, and for the moment we keep applying this mainly for what we call higher tonnage substances, so substances that are manufactured or imported above 100 ton or at 100 or above 100 ton per year. So now if you take that concept and apply that on the HBM for EU priority substances, you actually see that many of these priority substances are already in a way under a risk management approach. There's already risk management in place or being developed. So does it then mean that HBM for EU information is not important for that? No, absolutely not. I think HBM for EU information is absolutely critical. It can actually help ECHA in developing restriction proposals, because if you can show that there is occurrence of a substance in human population in the EU, you can actually immediately demonstrate that there may be an EU-wide risk, and that's a trigger for a restriction. So that's absolutely critical information. So HBM data really help us in, let's say, informing the need for a restriction. On the other hand, if new HBM data emerges and would reveal an occurrence of a not yet, let's say, a substance of concern that is not yet managed, it would immediately for us trigger a need for develop such an action. So all these approaches are complementary in a way to help going for the kind of fastest route for regulatory action. So HBM data is indeed very, very important for us. Thanks.
Thank you, Wim. Anybody else? Yes, Bruno.
Yes, thank you, Fleur. No, I just wanted to highlight it again, and I think it was also highlighted in the presentation in the but I think from EFSA point of view, I think the use of human biomonitoring data have always been a bit challenging. I mean, we have in principle a remit that is limited to dietary exposure, except maybe in certain domains like pesticides, where we also need to consider non-dietary exposure. But generally speaking, we are by our legal mandate, which is food, we are focusing mainly on dietary exposure. And it's quite difficult to make that link, actually. And this is really something I want to highlight, that currently under PARC, we already have some initiatives ongoing where we are actually comparing outcomes of previous assessments by EFSA with human biomonitoring. So we are doing, I mean, PARC is actually doing this in the area of, for example, pesticides affecting the nervous system, PFAS, some heavy metals as well. And so, I mean, just to make clear that we are really trying to understand how we can make best use of these data generated in monitoring. But as was explained in the presentation, we really now need to see how to further improve this integration, how we can best integrate this, what we call an additional line of evidence into risk assessment.
Thank you, Bruno. Definitely an area that is super useful for actually all our three agencies. So thank you, and also thank you for the question. So the next question on the list is by somebody who would like to know what are the research needs in relation to ARM, antibiotics and its residues, resistant bacteria and genes, and the drivers like biocides, heavy metals, etc., in food-producing animals and in the environment, soil, water, and air. I would like to start on this one. Would it be you again, Bruno? Can I give you the floor?
Well, for me, yes, it's fine to start. Yes.
Good.
So, no, I'm happy to take on, let's say, the start of this. So I think in terms of AMR monitoring and antimicrobial resistance monitoring, I think EFSA is already playing quite an important role. And we are doing this in close collaboration with other agencies, particularly in our field there, it's mainly with the European Center for Disease Control and the European Medicines Agency. But mainly the idea is there that we also try to follow, again, the One Health approach, in the sense that we are together with them, not only analyzing the occurrence of antimicrobial resistance, but we are also trying to analyze this together with the intake of antimicrobial substances so that we can start estimating those correlations as well. And I think when it comes to humans and, let's say, food-producing animals, we have already some EU-wide monitoring programs in place. So I think, but as was mentioned before, we could also, I mean, there might be further needs in terms of environment. So this is maybe more relevant for each one.
Yes, thanks a lot. Sorry. Who would go next? Yes, Magnus.
Yes, so Nadia in her presentation already mentioned one research need from our side. So that's looking into the environmental quality standards and the minimum inhibitory concentrations for AMRs in order to establish protective levels in the environment. But a small commercial here, we also have a brand new briefing out on AMR that can be found on our webpage, which also highlights some research needs. And this is especially with regards to the present in the environment of antimicrobial residues and also antimicrobial resistant bacteria and genes in the environment. So here we need more knowledge in order also to understand the extent of the problem and also understand how different environmental compartments can act as vectors for transferring these resistance genes into humans, for example.
Thank you, Magnus. And then maybe Wim, you would like to add?
Yeah, I can add from the biocidal perspective in a way, because biocidal activities in ECHA here cover this in a way. It's good to know that the possible development of the resistance of bacterial AMR is actually not a standard assessment criterion for biocidal products, but of course, if the information is available, it's taken into consideration. And currently, there are two main activities here under the biocidal umbrella. On one hand is the assessment of the azole-resistant patterns towards Aspergillus. That's what we're heavily working on. And further this year, there's also new guidance in development. So the resistance assessment guidance for biocidal active substances and products is led by France in cooperation with ECHA and some other member states. And it will actually provide a guidelines for the assessment of the AMR patterns. Should be actually ready by end of this year. So yeah, that actually illustrates a little bit what we're currently doing. Thank you.
Thank you all for this further insight on the AMR. Really interesting to hear. Maybe going further to a question on air breathers and bioaccumulation. So somebody asks, on the further research needs for air breathers, is it my correct understanding that the screening criteria for bioaccumulation should be validated against biomonitoring field data? Or are there already combinations of NAMs available for such research? Doris, yes.
Yes, I can take this one. Thank you. Well, to start with, we do have screening criteria. They are based on log-KRW, log-KOA, but they are very inclusive. So many substances fulfill these criteria. But it doesn't mean that all of those substances would bioaccumulate. So substances that are biotransformed rapidly will be readily eliminated, and therefore they are not bioaccumulative. And only substances which are taken up but cannot easily be eliminated by the air breathers are going to bioaccumulate. So we need further data to establish if a substance is really bioaccumulative or not, if they have been screened as potentially bioaccumulative. And for that, monitoring data can be very valuable. They can be used in a weight of evidence to confirm if a substance was taken up in an organism. They can be used to confirm if biomagnification or trophic magnification has happened. And for that, biomonitoring with apex organisms, that those on top of the food chain, are really valuable. However, if we confirm a substance via monitoring that data, that means that the pollutants have been already emitted to the environment. So it's a retrospective assessment. And what we would like to have is an approach to assess pollutants or chemicals before they are released into the environment. There is a definitive assessment possible. So the PBT guidance that has been revised and updated and published last year in December in 2023 foresees that a toxicokinetic study with rats can produce data on half-lives, so elimination half-lives. And with this information, we can establish whether a substance is very stable or can be metabolized fast enough in a mammalian organism, or for example also humans, that the substance is not bioaccumulative. The drawback is that a toxicokinetic study with rat, it involves vertebrate animal testing, and this is what we would like to apply only as a last resort and avoid if possible. Hence, in this PBT guidance, there is now a tiered approach proposed. So the first tier is the screening criteria that we had before. The last tier is this definitive assessment with the toxicokinetic study according to OECD TG 417. The new thing is now we have introduced an intermediate tier that would look at biotransformation from, for example, in vitro methods or QSARs. And here we see still further research needs to confidently use such information then to assess a substance, whether or not it can bioaccumulate in air-breathing organisms. Another research need, if I may add here, is also to go beyond mammalians. So at the moment we looked at mammalians, but next thing would probably be to look at birds or other air-breathing organisms.
Thank you, Doris. Yes, Jean-Luc.
Yeah, just maybe to highlight some of the tools that are available to assess biomagnification factor and bioconcentration factors. They're available in the OECD QSAR toolbox via the VIGA tool. So there are predictors available for both of these properties. But I think there's further work to be done, especially to explore a range of, log KOW to cover a range of substances from the structural perspective, but also from the fish chem perspective. So maybe something to think about together. Also using the avian databases that we have at EFSA and at ECHA, you could think that this could also support the development of such tools for birds. Thank you.
Thank you, Jean-Luc, for these suggestions. Anybody else from the panel would like to step in? No? Thank you both. That was very good. Thank you. Maybe to then stay a little bit in the subject on ionizable and surface active substances. Somebody asks, can ionizable and surface active substances really bioaccumulate? And can you explain more about the research needs? Jane, can I give you the floor?
Yes, so quick answer is yes, some can. Some ionizable and surface active substances can or have been found to bioaccumulate. So we know for the neutral organic chemicals that they tend to accumulate in the storage lipid, but ionizable and surface active substances behave a bit differently, or some do. We know that surface active substances, they prefer to absorb to the membrane phospholipids rather than, or as well as storage, or rather than the storage lipid. And ionizable substances, well, their behavior depends on pH. And actually, many surface active substances are also ionizable, so there's a kind of crossover there. So in summary, the log KOW, the octanol water partition coefficient, which predicts accumulation to storage lipid, doesn't work well for these substances, the ionizable and surface active substances. But we do have some data to show that some bioaccumulate. There's been some studies on the cationic surfactants, the alkyl amines, and the longer chain have been found to bioaccumulate in fish. And we know that some PFAS chemicals, for example, PFOS, they do bioaccumulate, although they have their own specific mechanisms. So we really need a screening tool, because we can't use the log KOW. We can't assume that that predicts the bioaccumulation potential of the surface active and ionizable substances. So we need something else, and some work has been done. We know with the membrane lipid water distribution or partitioning coefficients, there's a lot of promise, I think, in that approach, but it needs more development to be used in a regulatory context. And that would help if we have a better screening tool, then we wouldn't need to do so much higher tier testing of these types of chemicals. And maybe we need some more research as well about the mechanisms. We don't fully understand how these substances bioaccumulate, but some have been found to do so.
Thank you, Jane.
Thank you.
Thank you. Very clear. So going to the next one by Mathieu Bravin or Bravin. Do you see any interest in developing new biotests specifically adapted to measuring internal exposure to chemical mixtures rather than toxicological endpoints for improving the risk assessment in moderately and multi-contaminated soils? And if so, for which soil organisms in priority? Who would like to take this one? Yeah, Jean-Luc?
Yeah, so yeah, first of all, the question is rather complex because in ecotox we usually use a whole mixture approach when testing. So, for example, testing whole effluents. This question reflects the fact that here maybe the best approach would be to use what we call the component-based approach, meaning looking at the internal dose or the kinetic of the substance for every single compound. Now, if it's an extremely complex mixtures, it means a lot of analytical work before to identify those compounds that are in this complex mixture. And we may be talking about PFAS combined with heavy metals, combined with, persistent organic pollutants. So it really depends on the context of the assessment itself. When it comes to looking at the type of species we were looking at, well, we could think first for the soil of standard OECD species. So we would be talking about earthworms, maybe bees, but we know that for soil, maybe exposure is actually rather low. Can you hear me still?
Yes, we hear you. You dropped for a second,
Okay.
but now it's fine.
I think then we're also talking about mites, collembola, and potentially spiders as well, because they're not necessarily looking at as non-target species. So that would be my take on it. Now, of course, you can combine this with historical data. If you have historical data based on toxicity, such as toxic units, sum of toxic units for risk characterization, you could correct that for internal dose once you have these estimates.
Thank you, Jean-Luc. Anybody else? Magnus, would you like to add? Yes.
Yes, I think this is a very interesting question, also a very difficult one to answer. I think in a way, maybe it's different for pesticides, but for many other types of chemicals, we are not as advanced when it comes to ecotoxicological assessments of effects in soil as we are for the water compartment, where we have more standardized testing, we have more data also on the occurrence, and here, of course, we also have biota included in the protection goals when we are setting environmental quality standards. So for soil, we are not there yet, but it could be something, that will evolve in the future. I think, the internal dose is interesting because it gives the exposure, and soil is a very heterogenic material. So to go from predicted exposure to real exposure is something that is definitely has an interest. But I think to see how it will integrate into our management of chemicals has a little bit longer perspective than for some of the other areas where we are more evolved in our methodologies. But I think definitely it is a relevant scientific research issue.
Thank you, Magnus. And there is no particular view on the type of soil organisms that would be a priority.
I agree that it would be natural to start with some of those organisms where we have OECD test guidelines already on the ecotoxicological part, because then you would probably, it would be more easy to compare what you identify, the internal concentrations with the ecotoxicological test results.
Yeah. Thank you for this. Okay. Anything else on this? I don't see any hands anymore. Maybe we go to a nano question by Derek Knight. Please explain what R&D ECHA would like to enable read registrants to justify categories of nanoforms. For example, to justify read across between nanoforms and a non-nanoform of registered substances. Is this related to ECHA's project on NAMs for sets of for nanoset justification? That's for you, Wim.
Yeah, I can take that one. Very good question, very complex question also. As you know, there are new provisions under REACH for the safety assessment of nanomaterials. You can basically choose to register a form, a nanoform, or you can also opt for a set of nanoforms. And we're actually currently working on better criteria, better assessment frameworks to help registrants to fulfill their obligations. In a way, if you choose a path of set of nanoforms, you actually group them in a closely similar set of nanoforms, but you have to show that their hazard, exposure, and risk can be performed in a similar manner. So there is some variation in the form basically, but it doesn't impact the hazard, exposure, or risk. Now, that's very difficult. There is, for example, a tool out developed by ECHA. They've developed an app to help create these sets. What is, for example, still needed there is an assessment framework for the environmental properties. So we heavily would suggest more research in that area. And that's exactly what we're also currently working on in ECHA. Now for read across, which is basically when you use form A as a source to use data to, let's say, read across to your target of form B, basically, they're the same provisions as, let's say, the non-nano forms would hold. So the read across assessment framework there would also hold. Now, there's not so much experience there, and we definitely also are looking forward for case studies where we think we can assess, let's say, the possibility of read across based on the characterizes and then the human health and environmental property. So yeah, that's still a big area of research, indeed. I think for that, I think in the time given, I'll leave it at that with this question.
Thank you, Wim. Anybody else of the other agencies wanting to add? No. Thank you. Then we go to Ishita, who asks, I am aware that a lot of NAMs have been used for the developmental neurotoxicity assessment. What is the current status or data gap need in the field of reproductive toxicity endpoints? Anybody?
I guess, Wim, you can start, and I can try to add something on top.
I will start. Indeed, I mean, you may have seen that in our PARC document, there's not a particular section on what to do for particular endpoints. And that should not be taken as a message that these endpoints are not important. We simply wanted to prioritize in the overall realm of activities that we see those areas where the biggest needs are. And for example, reproduction is linked to the immunodevelopmental effects of chemicals, to the neurodevelopmental effect. There's always this repro angle there. Now, if the question would be for repro specifically, what would we need? Well, you're maybe familiar with the extended one generation reproduction toxicity study, the yogurts as we abbreviate it, which is a common request for industrial chemicals. There's still a lot of debate there on the sensitivity, the dosing regime, the power that you obtain with assessing the traditional endpoints. You have a immunodevelopmental, neurodevelopmental module there. what is the, let's say, usefulness of the data that we obtain there. That's currently also assessed in projects within the agency. So, and that has immediately an angle also on the endocrine disruption aspect. So while maybe repro is not visible as an endpoint, you will see that for us it is linked to immuno, to neuro, and to endocrine disruption in general, because basically linked to that endpoint. Also, for example, more towards environmental assays, we see reproduction is key. We have put a lot of attention to the replacement of chronic endpoints for fish, for example, because we see clearly that over time we should move away from the use of live fish testing. And we also believe that there's need to replace that endpoint for chronic environmental hazard assessment. So yeah, I think for that repro, I think important, a lot can be said, and we could have a specific session on that. But I think for now, that's what I would like to add. Maybe Andrea, you would like to add?
Yes, thank you. I think you spot very clearly the relevance of the EGOR project. So the ECHA database on the number of EGOR projects is impressive and contain many of the study, also the DNT and the DIT arm, so they can be extremely useful to really understand the sensitivity of this big study. A lot of animal, a lot of cost, a lot of expertise to interpret, and a lot of expertise for performing the study. So you need excellent lab. So that per se is a limitation, because where you need a lot of expertise, very often you have critical gap. I think the CARC document is excellent from this point of view, because it's very honest. In a way, it's not prioritizing because we have the in vivo study, and it's also not prioritizing because it's very difficult to set up priorities on using non-in vivo study for reproductive endpoints. The question starts with the DNT. We champion the DNT for the in vitro battery. We spend a lot of resources and a lot of effort to come to a point where we know how to use it and we know how to recognize the gaps and the uncertainty. So can be the same done for the reproductive toxicity endpoint? Potentially yes, but we needed to start in a way, I'm not saying from scratch, because embryo toxicity tests were in a way developed mainly for developmental endpoint, but I think the approach that was taken for the developmental neurotoxicity should be the examples, should be used to start similarly. And indeed, in September, at the SCAT in Switzerland, they want to start with this series of workshops to see how informative are the in vivo studies. And from this perspective, an analysis of, or a meta-analysis of the ERGO project would be extremely useful, but which endpoint can be measured in maybe a alternative animal model or in NAM solution. It remains a very difficult set of endpoints, and I will be very curious and very much interested in how this reproductive toxicity endpoint will be handled as part of the roadmap of the European Commission of phasing out the animal study. Because based on my experience, the most sensitive endpoints is the pup weight, and I don't think these reflect the reality of what's going on in the Western world in terms of endpoint of mechanistic based toxicity. It is likely that reflect a systemic of a general toxicity, because we need to apply high doses to be sure that we are capturing the hazard. But that in a way contrasts with this very, very sensitive endpoint that we don't know how much informative it is. So that's really complement what Wim said, but it's a very good question, very difficult to give an answer.
Thank you, Andrea. Thank you, Wim. Jean-Luc.
Yeah, just to go back to maybe one aspect. So let's imagine that we have those response data for some of those reproductive endpoints from tox scars from the COMTOX dashboard of the US EPA or in vivo data that are curated. One further complication is to know if it's the parent compound or the metabolite that is actually the proximate toxicant. For example, for thalidomide, we've learned historically that it is the metabolite of thalidomide that is the proximate toxicant. So we may again have to invest into understanding better the metabolism of those compounds in terms of reproductive toxicity as well. But I think this has been highlighted before as a need. So for kinetic properties, and that would help us to do the IVV using in vitro data sets.
Thank you, Jean-Loup. Very good. So complex, and a lot of discussion needed also on this one. Going to the next question on superhydrophobic substances. For superhydrophobic substances, would you have a pool of suspect substances for which to start the research? Doris, yes.
Thank you. Well, we do have examples. For example, Jane mentioned the chlorinated paraffins, but we do not have really a fixed set of superhydrophobic substances to start with. And reason is also that we don't even have a definition yet on what is a superhydrophobic substance. So it could be based on log KW, you could say above 6, 7, 8, somewhere there, or you could take an operational approach and say everything, all the substances that cannot be tested by an aqueous exposure bioconcentration test could fall under superhydrophobics, or it can be even other descriptors. If you would maybe wanted to get an idea how many superhydrophobics we are talking about, or could there be, I could suggest to look into the OECD CUSA toolbox, and because we got the question beforehand, I did that. And when you load, for example, the ECHA REACH database and predict log KW, I mean, it will not give you the super correct answer because of multi-constituent substances and so on. But if you look into that, you can get some 1,000 substances with log KW above 7 and 8 that are for sure interesting to look at. The highest log KW actually was 48, so it's really, really high. So that's why there is, I think, two difficulties. So on one hand, we would like to address bioaccumulation potential for superhydrophobics where there is an uptake in the organism. So the common test systems for aquatic bioaccumulation, they go up to maybe 8.5 log KW, but still there is a gap until where there is no uptake or no crossing of biological membranes. At the moment, we have a criterion of log KW of around 10, together with chronic data to support that there has been no uptake. So in between there, log KW of 8.5, 10, we don't really have lab tests to address very well bioaccumulation. So there I see definitely a research need, how to address those. When it goes towards substances that cannot even be taken up, we don't really have good means at the moment to assess that. So there is another research need to establish a not bioaccumulative, because we have many substances, as I mentioned, with log KW of 20, 24. It's really difficult to get that in any solution and to test. And I see also a link to polymers. So in the CARC document, we have also interpretation of polymers bioavailability. So there is a similar problem. So when do we need to assess and when we don't need to assess? How can we distinguish?
Thank you, Doris, for this nice answer. Anybody else like to add on this? No, thanks a lot, Doris. Then we continue with Dermo Riley. Can ECHA share a protocol for the testing of titanium dioxide coatings in poultry farms and pig farms to eradicate the need for animal antibiotics and prevent methane emissions? We wish to test photoactive coatings in farms. Would you like to give it a go, Wim? it feels a bit out of scope of this.
I would say so. In our, let's say, mandate, testing of TiO2 coatings in poultry farms and pig farms, I think I really have to, let's say, let the answer go. We're not addressing that, basically. If it is poultry food feed is an EFSA colleague maybe more.
I have no clue on this. I'm pretty sure it's something that is dealing with us, but I'm not aware of this.
Okay, thank you very much. And maybe, so we're very sorry we cannot answer this question. Maybe even though we only have one question to go, we are also already getting over time, and our panelists will have to start leaving in a minute or so. So I would really like to thank you all for the questions raised today and for your participation in this meeting. Special thanks also to all the panelists. The questions were quite complex and very diverse, so thank you a lot for responding to them so nicely. The questions will also be published on our website, so the Q&A session will be published there, so you will find your answers there as well. So with that, I wish you all a very good day, and thanks again for joining us. Hope to see you in the future. Thanks a lot.